good morning.
Good
How
morning.
are you?
I'm good.
I'm Pride. My name is Pride. I'll be your nurse for today.
My name is Nanette, and this is my daughter Bella.
Hi,
and,
Bella.
She has been very sick for the past 2 days with diarrhea, vomiting, and high fever also. She's been pulling at her ear, her right ear, and it has a bad smelling odor coming from her ear.
Okay.
And there's also a discharge coming from it, and she's only had about 3 wet diapers in the last 24 hours,
Okay.
which is worrying for me because it means that she's becoming very dehydrated.
Okay, thank you very much. That helps a lot. Let me ask you a few questions about Bella's health.
Okay.
So was Bella born, was she born a full-term baby? And did you have any complications during childbirth?
No, she was born at 38 weeks and 5 days with no complications.
Okay. Does Bella have any allergies?
Yes, because she developed some hives after eating a peanut butter. So because I put some gerber and then mix it with peanut butter, and then after that she's allergic to peanut butter.
Okay, so she has peanuts allergy. Okay, I just want to ask you some questions, and then I'll be taking notes. Or at least I'm asking you some questions so that when I call the doctor, I'll be able to explain everything that you just told me. Okay. So what medications or vitamins is she taking at the moment?
She is currently taking vitamin D drops 400 microgram daily.
Oh, that's good. You know exactly the amount, the
Yeah.
dose. Okay. Has she had all her immunizations?
She had 2-month vaccines, but we based her 4-month vaccines because I was working during that time.
Okay. No problem with that. Has Bella had any past illnesses, injuries, or surgeries?
She hasn't had any serious illness or surgeries. She is breastfed and started solid foods at 6 months.
Can you tell me about her diet? Like what type of food that do you give her, snacks or anything that you give her?
Actually, she is a well breastfed and started solid foods at 6 months.
Okay, that's great. I'll just take some notes. So I've taken notes of everything that you just explained to me. So Nanette and Bella, I'm going to do a physical assessment just to assess your baby Bella, her pulse, your temperature, respirations, and I'll just do a quick listen to her abdomen, and then I'll also check on her skin and then weigh the baby, and also I'll get the length and the head circumference of the baby. So can you kindly follow me to the room next to me so that I can do all those assessments of the baby?
Okay. Okay, knock knock.
Hi, you can come in. Okay, so she's wearing the one piece.
Yeah.
Okay, so I think we might have to remove the clothes so that I'll be able to properly do the assessment.
Okay, so you want me to remove her clothes?
Yeah, but before you remove her clothes, I can check her ear.
Okay.
Yeah, before you remove the clothes, I can just check her ear. Just check on the side, check on the discharge, the drainage. Just remove the clothes.
Baby, it's okay. I'm just gonna remove your clothes. Do you want her diaper on?
For now, yes. She can keep the diaper on because I don't want you to freeze. I'll just pull it down when I'm listening to the stomach. Yeah. just roll it a little bit down here, like that, so that only the stomach is exposed. And I can cover her feet in the meantime because I don't want her whole body to be exposed so that she doesn't feel cold. Okay?
Okay.
Yeah. Just make sure that this doesn't feel so cold. Yeah.
Are you okay, Bella? My little princess.
So just
It's okay, baby. She won't hurt you.
yeah. I'm just going to press this down. Stomach is soft. And I'll listen to her. There we go. Sorry, baby. She's not having it.
Is she okay?
Fine. Yeah, she's okay. And I'll just write my findings here. Okay, so the next thing is I want to put her on the scale so that I can get her weight. Just remove everything.
Okay.
Make sure that she's naked. Oh, sorry, baby. Sorry, Bella. Let's be quick. Okay. Make sure the scale is on 0. Okay, 9.5. Oh, she's so fussy. She's angry. She's crying.
Yeah.
I'm so sorry.
It's okay, you'll get warm. I'm gonna.
Okay, so now I'll just put this one before you put your clothes back on, just to get her. See, just whip it.
What's that?
Oh, this one, it will help me to get her pulse. Let's see, so just going into the monitor here. So her pulse is 130 beats per minute. So it's a little bit up, it's elevated. So I think maybe it's because that she's having a little bit of fever and her skin, she's warm to touch. Yeah, I'll just check also her temperature as well. Ooh. Make sure that she's a little bit covered. So just put it under her armpit. Her temperature 8.5.
Can I cover her now?
Yes, you can. I'm almost done here. I'm done with this. No, wait.
Oh,
I'm
sorry.
not done. I still have to do her leg. That's all right. Just do that quickly, and then you can quickly put
It's
it
okay,
on.
baby. Don't cry. Maybe she's cold. That's why she's crying.
Yeah, I know. No one wants to be naked. Okay, I'll just be quick.
Don't worry, baby. I will swaddle you later,
Yes.
so you will feel warm.
So just getting her circumference there, and then her length is 17. Yeah, good. You can.
Is it okay?
Yeah,
To
you
dress
can
her up?
quickly dress her up. Yes.
Okay.
Thank you so much, baby Bella. Okay, so her temperature is a little bit up, but that's normal for someone who's having a fever. So we can try and give her some. You can breastfeed her or give her some liquids, that electrolytes. Sometimes they do help with that, with the dehydration. Okay, so we can come and have a seat, and then I will call the doctor. Hygiene. Okay, and I'm going to call the doctor. Hello, good day, Dr. Frazier. My name is Pride. I'm a nurse from the community clinic in Pediatric. I'm calling about a baby Bella Stanton. She's 10 months old. She's a female child, and she's having symptoms of diarrhea for the past 2 days. She's vomiting. She is having symptoms of fever. Plus, she has a history of right ear pulling, and the right ear has foul smelling drainage. Her weight is 9.5. Her vital signs, they do show signs of fever. Her temperature is elevated, is 3.5 degrees Celsius, and her pulse is 160 beats per minute. After doing a physical exams, there are signs of mild dehydration, and she has an inflamed right tympanic membrane with purulent drainage. Her birth history is unremarkable. She has a known allergy peanut. She's currently taking vitamin D drops, and she missed a 4-month immunization, and her diet, she's breastfeeding, but she was introduced to solids. She started taking solids when she was 6 months old. So what orders do you recommend for her diagnosis?
Okay, thank you so much, Fry, for that accurate assessment and for the vital signs. For now, I want you to order some CBC and electrolytes, and also stool samples for the lab.
Thank you so much, Dr. Frazier. I'll go and explain everything that you just told me to the mom, and I'll start on the medication that you just advised me to take. So what's I'll just go and take the CBC and the electrolytes and the stool sample, and then I'll give you a call once I'm done with that. Thank you so much.
Okay, thank you.
Okay, bye.
Bye.
Okay. Nanette.
Yes.
So the doctor has ordered some blood works for the baby, and some stool samples, just to confirm what Bella has at the moment. And then we'll do the blood, we'll take the blood test, and we'll check the blood count and the electrolytes, and then at the moment we can start. The doctor advised me to just give you something to drink. So we can start with the electrolytes for the babies. So we can start with that, and at the moment we'll take some stool samples and some blood works.
Okay.
So we send you down to Clinic C for you to get those, to give those specimens. And can you go to the Clinic C, and then you can get the blood, the specimens, and then once you're done, you can come back and wait in the waiting area.
Okay.
Thank you.
Thank you.
Okay. Hello.
Hi, Pride. It's me, Dr. Fraser.
Hi, good day, Dr. Frazier.
Oh yeah, because Bella, your recent baby
Okay.
patient,
Yes.
she is positive to rotavirus
Okay.
that caused her diarrhea and ear infection.
Okay.
So for now, my order is you gave her oral rehydration, 90 meals every hour
Okay.
while she's awake,
Mm-hmm.
acetaminophen 10 milligrams per kilogram every 4 hours as needed for fever or pain.
Okay.
Then Ciprodex ear drops. So So it will be 4 drops in the right ear twice daily for 7 days.
Okay. Can I just repeat what you just said so that I'll write the correct information on the doctor's order?
Sure.
Okay, you said oral rehydration solution, 90 milliliters every hour while awake,
Yes.
and then acetaminophen 10 milligrams per kilogram every 4 hours is needed for fever or pain.
Yes.
Ciprodex ear drops, 4 drops in the right ear twice daily for 7 days.
Yes, that's good. Perfect.
Writing. Thank you so much. I'll just write the doctor's order and then send it to the pharmacy.
Okay.
Send the prescription to the pharmacy. Thank you so much. Have a good day.
Same to you as well.
Thank you.
Bye. Bye.
So Nanette and baby Bella, Dr. Frazier has reviewed Bella's results, and she has rotavirus that is causing her to have diarrhea, and also for the ear infection, she has prescribed some medication for that. So for the because she's having some diarrhea, so she's losing a lot of liquid electrolytes.
Yeah.
So the doctor suggested that you should replenish the electrolytes. So you can use, you can buy the oral rehydration solution and give 90 ml every day to the baby. You can put it in a feeding bottle, or just make sure that she's hydrated, and make sure you breastfeed her more often so that she doesn't get dehydrated. And then for the pain, the doctor prescribed acetaminophen at 10 milligrams every 4 hours for fever and pain, and you can use it as needed. And then the doctor ordered some antibiotic for the ear, Ciprodex. You can put 4 drops in the right ear every day for 7 days. Okay. Hi, Nanette. So the doctor ordered that we should give your baby acetaminophen for pain. That will help with the fever, and he ordered to say that we should keep the baby hydrated. So he ordered for the oral rehydration solution. You can buy from the pharmacy, and then you can give the baby 90 milliliters every hour when the baby is awake. Don't give the baby when the baby is sleeping.
Okay. So I cannot give her that oral rehydration while she's sleeping?
Yes, you cannot give her while she's sleeping. So I'm just gonna give you some more instructions before you go home. So if you see that the diarrhea or the vomiting is worsening of the baby, like if you, every time you change your diaper, if you see that she's not peeing a lot, maybe in a day you are changing at least 3 wet diapers in 24 hours, make sure you come back to the clinic. And if the baby, do you have a thermometer at home?
Yes,
Check the baby?
yes, I have.
So if you check the fever, right now it was 38.5. So if you see it's above 38.5 or 39 or 38.6 or 0.8, if it goes up, you can give the baby some acetaminophen, some Tylenol, and then if you see that the temperature is still up, it's not going down, you can try and do some other methods like
what will be the intervals for my acetaminophen? Like for example, my baby is temperature right now is 37 or 38.
Normally it's after every 4 hours.
Okay.
Yeah, or sometimes when they need it, but normally you should do it after every 4 hours. You don't have to, you're not supposed to give them more than 6 times in 24 hours.
Okay.
So the other things that you can that can help if the baby has a fever, you can give them a bath, like a cold bath, or take like a wet cloth and just put it on their forehead, or just clean them, let's wipe them, or just dab it on their skin. That also helps sometimes to lower the temperature down or to calm the baby down if they're having if they're having a fever, or if the baby become lethargic, or if they're having difficult like having problems with breathing. Make sure you go to the nearest clinic, and then if you see that the increase of the drainage from your ear, you can call 811 or call 911 if the baby is having difficult breathing problems, seizures, or if the baby becomes unresponsive. Did you get the number, or do you want me to repeat again?
It's okay, I got it. 911.
Okay. Do you have any questions, or do you want me to explain further about everything that I just said?
No, I'm fine. I understand what you told me. And yeah, I'm just concerned about my baby. That's why it's kind of frustrating to me that my baby is sick. But hopefully after administering or giving the medication for my baby, hopefully she will be fine.
Okay, and one more thing that I forgot, make sure you monitor how many diapers if she continues having some diarrhea, and also if she keeps on vomiting, make sure you monitor to check how many times did she vomit, and the consistency and the color of the vomit, okay?
Okay.
Thank you very much.
Thank
Have
you
a
so
good day.
much,
I hope you feel better, baby Bella.
Thank you.